A new study is raising serious health concerns about cannabis use. Researchers say it could be linked to a nearly fourfold increase in the risk of developing diabetes. The findings, presented at the European Association for the Study of Diabetes conference in Vienna, analyzed data from more than 4 million adults across the US and Europe. Researchers from Boston Medical Center studied electronic health records from 54 institutions in the TriNetX research network. They identified nearly 97,000 patients between the ages of 18 and 50 with cannabis-related diagnosis ranging from casual use to dependence and withdrawal. That group was matched against a much larger sample, over 4 million adults with no history of substance use or major chronic illnesses. After tracking both groups for 5 years, researchers found a significant difference. 2.2% of cannabis users developed diabetes compared to just 0.6% of non-users. That translates to a nearly 4 times greater risk of developing the disease. The analysis accounted for other risk factors like high cholesterol, high blood pressure, alcohol use, and even cocaine use. The exact cause behind the link remains unclear. Scientists suspect insulin resistance and poor dietary habits may play a role. They also stress that more research is needed to determine whether the risk varies depending on how cannabis is consumed, by smoking, vaping, or through edibles. Despite the scale of the study, researchers caution it does not prove cannabis use causes diabetes. The data is retrospective, and not all factors like specific consumption patterns could be fully tracked. Still, the findings suggest a need for closer metabolic monitoring in patients who use cannabis and stronger public health messaging about potential long-term risks. Worldwide, cannabis is on the rise, with more than 219 million users reported globally in 2021. As its popularity grows, doctors say understanding its long-term health impacts is more important than ever. For now, researchers recommend caution and more study before drawing firm conclusions. Akugizibwe, STN News.